Hello, everyone, and welcome to our Partnering for Vaccine Equity Learning Community event. I'm going to give it one more minute. We still have several people joining from the waiting room. We'll get started momentarily. Okay, we're a couple minutes past the hour, and we are keeping this learning event to 45 minutes, and so I'm going to get started. Hi, everyone. Welcome. My name is Bridget Courteau, and I am directing group learning for the Partnering for Vaccine Equity program. I work for an organization called the Urban Institute, and I am really excited to be here with you and to work with you all over the course of this program. And very excited to welcome you to our very first official learning event for the program and for the learning community. Next slide, please. Today we are going to get an overview of the COVID-19 vaccines from two experts in immunization. And I'm going to introduce them and then hand things over to them. So we will hear from Dr. Yabo Beysolow and Lisa Jacques-Carroll. So Dr. Yabo is a pediatrician with over 20 years of experience in private practice and urgent care settings. She's also a public health professional with several years of work experience at the CDC in Immunization Services Division. Since 2020, Dr. Yabo served as an educator and chair of the EPIC immunization program for the Georgia chapter of the American Academy of Pediatrics, educating healthcare providers across that state. She's also a wife and a mother, and she's actively involved with the wellness ministry of her church. She's organized and led multiple medical mission trips to Liberia and Angola between 2008 and 2019 to provide free health services. Lisa Jacques-Carroll is an independent consultant with 20 years of immunization experience, working at the state, national, and international levels. She began her career in Michigan's immunization program and later spent 6 years coordinating the CDC's perinatal hepatitis B prevention program. She was a consultant to the WHO, providing technical assistance to other countries on the introduction of new vaccines. And she later worked for CDC's Global Immunization Division, coordinating the activities of that agency and various partners. Her last CDC assignment was as the Deputy Program Manager for New Mexico's immunization program. She currently consults for the Association of Immunization Managers, Immunization Action Coalition, the Coalition for Global Hepatitis Elimination and Task Force for Global Health, and the World Health Organization. So both Dr. Yabo and Lisa currently serve as immunization subject matter experts working with the Association of Immunization Managers, or AIM, and CDC's REACH program to provide guidance and expertise on increasing flu and COVID vaccine rates in racial and ethnic groups experiencing disparities. AIM and REACH are part of our Partnering for Vaccine Equity Learning community. So I know that some of today's session attendees are from AIM or REACH, and might already be familiar with the great work that these speakers are doing. And before I turn it over to our speakers, I did want to cover just a few housekeeping issues for everyone. So today's webinar is being recorded. We will have materials and recording which we will circulate for all learning community members within a couple of days. So it might be after the long holiday, but it will be soon. Everyone is muted right now. We will open up and allow you to unmute yourselves for the Q&A, which will be the last 15 minutes. So The presentation piece will be about 30 minutes, and then we'll allow for hopefully around 15 minutes of Q&A. At that point, you will be able to unmute yourselves. And I encourage you to post questions as we go in the chat, and we'll include those in the question and answer as time allows at the very end of the session. So everyone, I think at this point, everyone's very familiar with Zoom, and you know that at the bottom of your screen, there's a little chat icon, and that's how you can chat to the group. So make sure that you're chatting to everyone if you want to send a Q&A for consideration for the very end of the session. All right, and with that, I am going to hand things over to our speakers. So I think you can advance the slide, Louise.
Thank you, Bridget, for that introduction and for inviting us to present today. And thank you, everyone, for joining us. So today we will be providing an overview of currently authorized COVID-19 vaccines in the United States. Next slide, please. So at the end of the session, you will be able to describe the currently available COVID-19 vaccines and their ingredients, vaccine effectiveness, recommendations for the use of the vaccine, and safety of the vaccine. Next slide, please. Next slide, please. There are three main types of COVID-19 vaccines. There are messenger RNA or mRNA, protein subunit, and vector. And all three vaccine types either deliver or cause our bodies to make harmless proteins that are found on the surface of the COVID-19 virus. And after vaccination, our immune system recognizes these proteins as foreign and develops antibodies against the proteins. And then our immune system attacks and blocks the COVID-19 virus if we get exposed to it in the future. And this slide does mention Novavax vaccine, which is not currently authorized in the United States. Next slide, please. This table provides an overview of the three COVID-19 vaccines that are authorized for use in the United States as of today. The first two, Pfizer and Moderna vaccines, are mRNA vaccines. They both require 2 doses, and they had greater than 90% efficacy in clinical trials. The third is the Johnson & Johnson Janssen vaccine, which we will also refer to as the J&J vaccine. This is a viral vector vaccine that only requires 1 dose. The overall effectiveness is 66%, but the vaccine is 72% effective at preventing moderate to severe disease and 85% effective at preventing severe disease. Please. Now let's look at the ingredients found in the COVID vaccines. COVID mRNA vaccines contain messenger RNA or mRNA, lipids, which are bubbles of fat, salts, and sugar. Next slide, please. The J&J vaccine contains the ingredients listed on this slide, including sodium chloride, which is table salt, and water. And many of these ingredients that are in the J&J vaccine can also be found in other commonly used vaccines. Next slide, please. COVID-19 vaccines do not contain any of the ingredients listed on this slide, including fetal material, DNA, antibiotics, blood products, preservatives like thimerosal, gluten, egg proteins, pork products, or microchips. Next slide, please. Now let's talk about whether COVID-19 vaccines prevent you from infection. Next slide. The clinical trials found the Pfizer, Moderna, and J&J vaccines were extremely effective at preventing infection from the virus and/or from preventing severe disease, hospitalization, and death from COVID-19. The clinical trials were conducted with a diverse group of participants, including people of Asian, Black, Hispanic, Latinx, and Native American descent. And the trials found the vaccines are equally effective across age, gender, race, and ethnicity subgroups. Several studies in adults who have been vaccinated with Pfizer, Moderna, and J&J vaccines show that they continue to provide significant protection against COVID-19. Next slide. So how long does immunity last? Studies to date indicate that protection may persist for up to 8 months after COVID infection and for up to 6 months after receiving the second dose of an mRNA vaccine. However, studies are still ongoing and scientists will continue to gather information and update recommendations accordingly. There was even a study that was released this week that suggests that the Pfizer and Moderna mRNA vaccines may provide protection against the coronavirus for years. But again, scientists are still studying this and we will know more as we have more data. Currently, there is no recommendation for a booster dose of COVID-19 vaccine. Next slide, please. So do the vaccines protect against variants? Viruses are constantly changing by mutating, which is how they spread and survive. And these changes cause viral variants. There are several COVID-19 variants of concern that are currently circulating in the US and around the world. And one that you've probably been hearing about is the Delta variant. The Delta variant has a higher risk of spreading, and it may lead to more severe disease and hospitalizations, particularly among those who are unvaccinated. Scientists believe that a complete series of any of the current vaccines that are authorized in the United States, so either 2 doses of Pfizer or Moderna or 1 dose of the J&J vaccine, should provide protection against the Delta variant. To protect yourself from COVID-19 and any of the variants that are circulating, get a COVID-19 vaccine when it's available to you and complete the vaccine series to ensure full protection. And you can also continue to follow the CDC guidelines about masking and social distancing, avoiding crowds in poorly ventilated spaces, and washing your hands. Next slide, please. And now I will turn it over to Dr. Yabo to talk about the COVID-19 vaccine recommendations.
Great. Thank you so much, Lisa. And it's such a pleasure to meet all of you virtually and share some additional information with you. Again, I'm Dr. Yabo Beysolow. My colleague Lisa has given you an overview of the 3 currently authorized vaccines in the US, how they work, their ingredients, how well they protect. So now let's look at some of the recommendations, meaning who should get the vaccine, what to do after getting vaccinated, and hopefully answer some of your questions about vaccine safety and some more frequently asked questions. Again, if you have questions, please enter them in the chat so that we can refer to them during the Q&A. So thank you for putting up the next slide for me. And who should get the COVID-19 vaccine? Really, everyone 12 years and older, unless they have a contraindication to getting vaccinated. Because we know the virus can affect all people in all age groups, it does not discriminate. So unless someone 12 and older has a medical contraindication, it's recommended that they receive one of the 3 currently authorized COVID-19 vaccines. So for the Pfizer vaccine is authorized for persons 12 years and older. For Moderna and J&J is 18 years and older. And we'll talk about one of the concerns with the J&J vaccine, where it's recommended that women younger than 50 years be made aware of a rare side effect from the vaccine that is still being looked at to see if it's truly as a result of the vaccine, and that there are other COVID-19 vaccine options available to them as well. You may also ask, well, how many doses of a vaccine, of the COVID vaccine, do I need? If you're getting either Pfizer or Moderna, is 2 doses. Pfizer doses should be separated by 21 days. Moderna doses should be separated by 28 days. The J&J vaccine only requires 1 dose. At this time, after you complete your vaccine series, no booster doses are recommended. People also ask, well, can I mix and match, meaning get one vaccine and then another type of vaccine the second time? No, this may change in the future if scientists determine that it's safe to do so. But for now, if you receive Pfizer for dose 1, then it's recommended you get Pfizer for dose 2. If you receive Moderna for dose 1, it's recommended you get Moderna for dose 2. make sure that you get your appointment time for the second dose while you're there for your first dose. Next slide, please. So people often ask, can I get the vaccine if I have a certain medical condition? And CDC does recommend that people with underlying medical conditions such as asthma, diabetes, liver, kidney, lung disease, that they get vaccinated. Also, persons who are immunocompromised, or you may say immunosuppressed, either due to a medical condition or to medicines they're taking that suppress their immune system, they're recommended to get vaccinated. And also people with autoimmune conditions. With all three of these types of conditions, you're at increased risk of getting very sick, being hospitalized, or dying from COVID disease. All of these diseases, COVID can cause you to have a flare-up or exacerbation. Say if your asthma is stable, you could have a flare-up of it if you were to contract COVID-19 disease. So it's so important to get vaccinated to protect yourself. Always check with your healthcare provider if you have questions about any of the vaccines and find out what they recommend for your particular situations. Scientists are also still studying how the vaccine may work in someone who's immunocompromised. The vaccine may not offer that same level of protection for persons who are immunosuppressed. And so these persons really need to speak to their doctor about additional precautions, such as continuing to wear a mask all the time and practicing social distancing, even after they've been fully vaccinated. Next slide, please. We want to just turn our attention to COVID disease and pregnancy. Studies have shown us that pregnant women who develop COVID-19 disease have an increased risk of being very severely affected, being hospitalized in the ICU, perhaps needing to be on the ventilator, or unfortunately may die from COVID-19. The risk is greater in pregnant women who also have underlying conditions such as, say, diabetes or obesity. The risk of preterm birth is also increased in pregnant women who develop COVID-19 disease. Next slide. So because of this, all of the organizations listed here, including the CDC, the American College of Obstetricians and Gynecologists, or ACOG, family doctors, nurse midwives, etc., have all put out this joint message urging that COVID-19 vaccines be made available and accessible to pregnant and breastfeeding individuals. Next slide. So what are some of the benefits of vaccinating a pregnant person? The vaccine, of course, is first given to protect the person who's pregnant. Secondarily, it can also provide protection to the baby as well. This is still being studied. Just as we have other vaccines that have been given to pregnant people for years now, like the flu vaccine or the whooping cough and tetanus vaccine. When a pregnant person is vaccinated while they're pregnant, they make antibodies or fighting cells, just like the rest of us, to protect them in the future in case they come in contact with the actual COVID-19 virus. Pregnant persons can then pass these antibodies or protective fighting cells to the baby and hopefully prevent newborns from getting COVID-19. These antibodies can also be passed on to the baby through breastfeeding. We do know that pregnant individuals were not included in the clinical trials before the vaccines came out of the market for everyone. There were a few women who got pregnant during the trials after they were vaccinated, just a few. But since the vaccines have now been used in millions of individuals across the US, several pregnant women have been vaccinated at various times during their pregnancy, before becoming pregnant, and so we've learned a lot. These women are part of what's called a pregnancy registry to see how well they and their babies do with vaccination. And what we found as of June of this year, in over thousands of these pregnancies, we have not seen an increase in any safety concerns in those who receive the vaccine during pregnancy. There has not been an increase in miscarriages, nor stillbirths, nor other pregnancy complications. There has not been an increase in preterm births or birth defects in those who are vaccinated. We have to remember that these vaccines are also, they're not live vaccines. There's no risk of the virus being given to the person who's vaccinated or those around them. So again, we just recommend that if you're pregnant or breastfeeding and have questions, please consult with your healthcare provider. And women who are breastfeeding are also recommended to get the COVID-19 vaccine as well. Next slide, please. There's some new information as of this spring that COVID-19 vaccines may now be administered at the same time as any other vaccine that the patient is eligible for. Earlier on in the pandemic, there was a recommendation to wait 2 weeks between getting the COVID-19 vaccine and any other vaccine, but that waiting period has now been removed. So now we'll turn our attention on the next couple of slides to a few people who should not get vaccinated. Next slide. And this short list includes anyone who has a history of a severe allergic reaction to a prior dose of the vaccine or a part of the vaccine. For example, someone who had what we call anaphylaxis. That's when your throat may swell or you're unable to breathe or you require medical intervention because of the strong allergy. Also, someone who's experienced in the past any allergic reaction to any dose of the vaccine or any of its components. These people should not get vaccinated. They need to talk to their provider about options. We also know that by age group, there are various options. For those younger than 12 years of age, unfortunately, there's currently no authorized vaccine available. For 12 to 17-year-olds, Pfizer vaccine is available. And for those 18 and older, any of the 3 authorized vaccines are available. As scientists continue to study these vaccines in younger children, making sure that they're safe, these limits may change. So stay tuned for that. Also, we know that if you're currently sick with COVID-19 disease and you're isolating because of it, you should get vaccinated once you're completely recovered from your illness. So in the future. And we're even finding now that persons who had COVID-19 disease and then get a dose of COVID-19 vaccine once they're recovered, their immune response is even stronger and better. So it's very important that even someone who's had the disease before still get vaccinated. Also, if someone's been exposed to someone with COVID-19 disease and they're quarantining because they don't want to potentially infect other people, they should wait until their quarantine is over before getting vaccinated. And then lastly, there are a few people who recently had COVID-19 and they were treated with things called monoclonal antibodies, treatments that are reserved for people who are very sick with COVID disease. These people are advised to wait at least 90 days, 3 months after treatment in order to be vaccinated safely. Next slide. So what do you do after you receive your COVID-19 vaccination? Next slide. Be aware that you may have some side effects, and these may include pain, soreness, or redness at the actual injection site. You may experience headache, fever, tiredness, nausea, muscle aches. And these side effects usually occur within a day or 2 after vaccination. They last only for a few days. We see them more after the 2nd dose of Pfizer and Moderna vaccines. But these are normal. These are expected side effects. They are a sign that your immune system is active, trying to kill off what it thinks is the real germ. So that's why you're mounting a fever, trying to kill off what they think is an actual germ. However, not everyone may experience these symptoms, but your immune systems are still just as active. So you may want to consider planning your vaccine doses with the possibility that you may not feel so well the next day. And if you're lucky enough to do so, plan accordingly for work or school activities for the next day. Also, if you have these side effects after the 1st dose, please still take your 2nd dose of vaccine. 2 doses are what are needed to give you close to that 90% protection. Speak to your healthcare provider about medicines that you can take to help with the symptoms you may experience. And then, of course, anyone who suffers symptoms outside of those we mentioned here, please seek help right away. Next slide. We also want to remind everyone who's vaccinated, this is a voluntary app that we're asking you to sign up for. It's called vSafe. You can register using your smartphone, and they'll send questions to you initially daily and then weekly, asking if you've experienced any symptoms or potential side effects from the vaccine. And this is one of the many safety monitoring systems that are in place that has allowed us to quickly recognize any concerning events that are occurring after vaccination. So we encourage you to sign up for this. It's completely voluntary. Next slide. So let's look at how we actually monitor vaccine safety. On this next slide, we know that the 3 authorized vaccines were developed in a faster than usual process, yes, but all were extensively tested for both safety and to make sure that they worked. They met all the same usual FDA safety standards as for all other vaccines. No shortcuts were taken. They will be carefully monitored continually for the next couple of years to detect any problems or side effects. And we know that millions of people in the US and other countries have already received these vaccines. And so these safety monitoring systems are in place and they help us quickly identify if there are any concerns. On the right here is an infographic on this vaccine safety development from the Vaccinate Your Family. And this will be included in the slide sets as a resource that you could use in your trainings in your communities. Next slide. As a result of these safety monitoring systems, we have been able to identify 2 safety concerns that you may have heard about in the news recently. The first one is something called TTS, or thrombosis with thrombocytopenia syndrome. This is where your body develops blood clots, but at the same time, your blood cells that allow you to clot or stop bleeding after you get a cut are very low. So it's 2 things happening at one time. It's very rare and unusual. Some of these cases were reported in persons after receiving the J&J vaccine, particularly women under the age of 50. And CDC and other scientists have studied this and also looked at the fact that COVID-19 disease itself can lead to blood clots. At this time, it's recommended that the vaccine continue to be used with that warning to persons, especially women 50 years and younger. We also know that CDC and its partners are actively investigating reports of something called myocarditis and pericarditis. That means inflammation or swelling within and around the heart. And that is occurring in some participants who received Pfizer and Moderna vaccine, very small numbers, particularly in male, adolescents, and young adults. And this is still being studied. At this time, CDC continues to recommend that persons 12 years and older receive the Pfizer vaccine. A warning has been placed about these events in the sheets that you get after receiving vaccination. And we know that COVID disease itself can also lead to heart complications. And so scientists are very much looking at this to make sure that we do what's best for the population. Next slide, please. And finally, before we end, we wanted to address some of the facts about COVID-19 vaccine and hopefully answer some of the questions that you may have heard in your communities and within your families. So on the next slide, there are 4 facts that we wanted to bring forth. 1, the vaccines cannot alter nor change your DNA. Remember, as Lisa pointed out, these vaccines provide your body a message or a code to make the spike protein. That's the protein, is a harmless protein on the surface of the coronavirus that causes you to get COVID-19 disease. Once your body makes this spike protein, it sees it as foreign, it sees it as something that should not be there, and it tries to fight it off by making antibodies or fighting cells. So that way in the future, if you come into contact with the actual virus, you're protected because you already have these fighting cells ready to go. We also know that people who've gotten sick with COVID-19, like I mentioned earlier, still benefit from getting vaccinated because you can get COVID twice. Also, we have the new variants that are circulating. So you unfortunately could get another strain. So it's so important to still get vaccinated once you're completely recovered. And we hear this argument or rumor, a lot about COVID-19 vaccines causing fertility problems in both men and women. The rumors surrounding this have no scientific basis. And so we want to stress that it is recommended that you receive COVID-19 vaccine if you're contemplating or considering becoming pregnant in the future. There's no basis for these rumors. COVID-19 vaccines cannot give you COVID-19 disease. Remember, they're only giving your body, again, a message or a code. They're not live viruses. They cannot grow in your body. You cannot leak the virus out to someone else after being vaccinated because you are not vaccinated with the actual virus. So with that, I think we have a lot of questions in the chat, and we will try to go through those now. I know we've been trying to answer them as we went along, and I'll turn it over to Bridget as well in case she had any to share.
Thank you, Dr. Yabo. Thank you, Lisa, for that succinct but information full presentation. So very clearly laid out, which I'm sure many of us appreciate. So I know that one question that's come up, of course, is whether these materials will be available. And yes, we will be circulating them, both the slides and the audio recording within a couple of days to all learning community members. Likely these will be coming through your primary recipient via the CDC project officers. We are, as part of our learning community, we're creating a members only virtual platform, a website. And once that is up and running, within the next few weeks, we'll be able to post our materials there. So you'll have easier, quicker access to them. But I expect you'll be getting them via your project officers sometime early next week. I think we have answered most of the questions that were in the chat. I did see one, I think, from Allison that I'm not sure we answered. Examples of medical contraindications that would make an individual vulnerable to the vaccine. That could have been answered and I missed it.
Sure. Thanks, Bridget. Yes, so I saw that from Allison as well. Again, every situation is so specific, so you would really need to talk to your individual healthcare provider and say, hey, I have this condition, I'm on these medications. Is it okay for me to take the vaccine at this time? And so that's something that will have to be worked out, but no general rules on that. Another question I see, monoclonal antibodies. So that is not a vaccine, and that is a therapy. There are several ways we can try to combat this deadly COVID-19 disease. One of them is by protection with vaccination. Another is what's called therapeutics, meaning if you're severely ill in the hospital, there are medications that can be used to help you during your course of your illness, and one of them are called monoclonal antibodies. So that's something you should be asking for if you or family member unfortunately are in the hospital. We see another one. When did we find out people who had COVID have 8 months of protection? That was just some recent studies that came out. They were discussed at every quarter. The advisory board to the CDC is called the ACIP. They meet and discuss vaccines and what we've learned so far from all the studies around the world. And this was one of the studies that came out. Again, we're still continuing to learn this. It may be longer, but remember, we only started looking at this since last year. So we can only go from month to month and test people who've had the disease or who've had the vaccine. And every month we'll be able to say, okay, they have 8 months protection, or they have 9, 10 months, etc. So that's where we are now.
I see a question here from John about guidance for messaging to young adults. He specifies 18 to 25-year-olds related to vaccine hesitancy. So I know that's a slightly different topic. I will say in response to that we have been, we are still early in our sort of needs assessment. I think many of you completed that survey for us a few weeks ago where we asked you what were you interested in learning about, where did you have areas of expertise. Messaging for young adults is something that came up several times, and I've heard that question asked also in some of the recent events that CDC has had, including one yesterday. So we are planning some sort of learning event focused on young adults, likely sometime in the fall. So we are working on it. We know that that's an area that many of you are interested in. We're hoping that you all can connect with one another via our virtual platform when it is open to be sharing some best practices and some ideas on that. So, and I don't know, Lisa or Dr. Yabo, if you have anything specific to add related to that, to young adult messaging.
I was actually thinking, you know, we have a whole other presentation on vaccine messaging. Like there are so many resources out there on addressing vaccine hesitancy. Although I don't know that we're quite so far on specifically younger people. I think that is sort of evolving right now. And I'm sure that there are groups, lots of groups out there working on that right now, to, find messaging that resonates with younger people and like getting younger people on board to help with, social media and, getting messages across. So I think that is one strategy that some organizations are using, is trying to recruit like youth ambassadors, younger people, to try to help with some of their messaging, just because it's probably more effective if it's coming, from someone of a similar age. But yeah, there are a lot of different websites and organizations out there that have a lot of good sample messaging that you could, adapt. But again, we don't really have those handy right now to share. And then there was a question about, it says CDC states the chance of spreading COVID-19 are reduced after being vaccinated. Does that mean there is still a chance? And yes, there is still a chance of some breakthrough infections, even if someone is fully vaccinated. And those are rare, and they're generally, milder infections, but it's still possible. And so that, that is something that we know is happening, that there are some small percentage of breakthrough infections in fully vaccinated individuals. And it might even become more common with the different variants that are circulating. We're just not quite sure about that yet. But the vaccines should still protect against severe disease and most hospitalizations, things like that. So it's definitely important to get vaccinated. And Dr. Yabo, I don't know if you can take the question that's pretty technical about immigrants that received AstraZeneca vaccine abroad, but they're here now.
Correct. Yes, thank you. So CDC actually has guidance for travelers about which vaccine to take depending on what you took in another country, and it's not authorized here. So once I'm done answering, because I don't want to lose my space here, I'm going to copy and paste that link into the chat to share with you for that guidance, because there were 2 questions on travelers and what to do if they're either leaving here or coming into the US. But yes, just definitely wanted to echo what Lisa mentioned. No vaccine is 100% protective. So there's always a chance that you might unfortunately fall into that 5% with Pfizer and Moderna who may still get the disease, but those breakthrough infections have been rare and most of the cases have been mild. I do see a question: how do we help parents understand myocarditis so that they feel comfortable in getting their sons vaccinated? That is a great question. We're all parents as well. And so one of the things I would start with is that myocarditis and heart disease can occur with COVID-19 disease as well. And what we're finding is that there's a difference. If you have COVID-19 disease and develop heart inflammation, is a lot more serious. And we don't know what the long-term effects are. What we do know is that for the very few people who have developed myocarditis sometime after getting vaccinated, those cases are mild. They last a few days to respond well to treatment. So really just letting parents know the full picture, letting them know both sides of it.
Thanks, Dr. Yabo. I see just one final question here about getting a vaccine in another country. So a slight variation on, and I don't know if the resource you were planning on pasting in could also address that question, not just for people who may have gotten 1 dose somewhere else and are now in the States, but also for people considering or who might have an opportunity to get a vaccine in a different country that is not one of the ones that's offered here. sounds like yes. So Dr. Yabo will be sharing a resource in the chat. And we can also grab the resources that are shared from the chat, and when we circulate the webinar materials, we can make sure that those are pulled out for you all as well. So any additional questions that anyone wants to put in the chat, or I believe you all have the ability to unmute yourselves. If not, I think Louise can do that for us if anyone would rather speak their question. All right, and while I know we only have a couple more minutes, so while we still have a critical mass here, I just wanted to also plug our next learning event, which will be on July 14th at 3 p.m. For those of you who are already part of the Partnering for Vaccine Equity listserv, an announcement was either sent earlier today or will be sent very soon. Yes, July 14th. Will be sent very soon, so you'll have this information to register. Some of you, your programs are new enough that I don't think you are on the CDC's listserv quite yet. In that case, information about our learning events will be coming through project officers, and if you're a subrecipient, through your primary recipient. So it's a little bit of a couple-step process to get them to you. Again, once we have our website up and running, which will be very soon, we'll have more of a direct communication path with you, and you can also find out about our events that way. But if you'd like to save the date, July 14th at 3 p.m., it will also be a 45-minute webinar, and the focus will be Kaiser Family Foundation resource. It's a campaign that Kaiser and a couple of partners have created called The Conversation or La Conversation. So it's a pretty exciting set of resources and some social media focused toolkits that are focused on messaging around vaccine hesitancy. So that will be on July 14th, and we're looking forward to seeing hopefully many of you then. Thanks again to Dr. Yabo and Lisa for sharing your expertise with us. Really appreciate it, and thanks to all of our participants too.
Thank you.
Thank you. And Bridget, I'm still looking, but I'll share that specific website with you. But thank you, everyone.
Okay, great. Yep, we'll get it to everybody through our materials circulation. Really appreciate everyone's participation. Enjoy the rest of your afternoon, and have a nice long weekend.